October is Women's History Month, a time to honor and celebrate notable women and their achievements. Throughout this month, we've been introducing you to women in Manitoba who are breaking barriers. Well, tonight we want to highlight the work of Dr. Annie Drapeau, a pediatric neurosurgeon at HSC Children's Hospital. Brittany spoke with her last week.
Dr. Drapeau, you have had such a profound impact on the lives of young children and their families with the work that you do. And as the first female neurosurgeon in the province, what made you want to get into this career?
It's a really good question. I think it was mainly the mentors that I met along the way. I was never around doctors or definitely not neurosurgeons growing up, but I was interested in sciences and was pretty good at math and all those things. So gave medicine a shot. And then I met really fantastic neurosurgeons where I was doing my med school, and they encouraged me to follow this path. And every step of the way has been because of different mentors along the way. And that's the reason that I'm here now today in Manitoba.
So you've introduced minimally invasive head and facial surgeries, and these can mean less scarring and really reduced complications for kids that you treat. So can you tell us about the impact these surgeries have and what it really means for patients?
Absolutely. I learned these techniques during my specialty training in Columbus, Ohio, from other fantastic mentors. And then when I joined the group here, the fantastic team here was already doing great work on children with craniofacial differences. It's a combination of neurosurgeons and plastic surgeons who work together. But I helped to introduce this minimally invasive technique to be used a little bit more here. That requires mainly just one small scar where we remove a strip of bone to unlock and unfuse these skulls that have been abnormally fused at birth. And it's a much shorter surgery, a lot less blood loss during these surgeries, and much better tolerated for the patients afterwards. For example, they actually only stay in the hospital overnight, and then they get to go home the next day. They don't need to be in the intensive care unit anymore, and they rarely need blood transfusions. And, the impact that it has is that, again, it's much easier to handle for the patient, the family, and even our nursing staff and just the whole hospital team. The other day, actually, one of the nurses came up to me and was like, "Oh my gosh, Dr. Drapeau, this is amazing how quickly and well these patients do after this minimally invasive surgery." And I think that's the best compliment that you can get, to see the impact across the entire board, really.
It really is such amazing work that you do, because so often families are seeing you because they're going through something that's really difficult. So it has to be a really incredible feeling to see the work that you do literally changing people's lives in real time. Talk about the impact that you feel after helping people.
It's a very privileged position to be in to, as you say, help these people through a really difficult time. And I, see that as important as much as the surgery of being, a calm listening ear and a clear communicator to explain what will be, the surgery and what to expect after surgery. But I think, where do I see that impact, truly is when I see the kids grow, go to school and, become their own little person. For example, I actually have a family from the institution where I worked before in Ohio, and they still send me photos. We, they have my, phone number, and, we exchange photos of, the most recent was their daughter going to a Taylor Swift concert. And, to see that I play that role in their life, and that they'll still remember me, many years later, and that she's doing, that well, that she can go and enjoy herself and feel confident, at a fun event like a Taylor Swift concert. I think there's no greater feeling or accomplishment than that.
While I have you here, you also do research. Why is it important to you to keep working towards more advances and changes in your field?
Yeah, I think, we always have to look towards the future and always have to find ways to do better. We need to understand more about the conditions that we treat. My areas of interest are often actually maybe less scientific or less mathematical or statistical, but more about what is actually important to these families or to patients, and kind of thinking a little bit more, what we call patient-centered outcomes. So things like, are they satisfied with the results? How stressful was it to go through surgery and all of the appointments? How can we improve that entire process? And how are they doing in school? Are they happy with their appearances, even though they still have, potentially some residual craniofacial differences? So, I think there's that aspect of trying to really see what's important for patients and their families, and doing better over time based on the priorities that they set for us. And then my other areas of interest are things like quality improvement and safety, and again, learning from what we've done in the past to try to continue and do better, and to really, as a surgeon, be at the core of trying to find solutions and understanding how we function, why were there mistakes, why were there complications, why wasn't the process as efficient as it should be, and where can we improve? And so I think if we stay in the past, we'll never get better, and we have to look to the future and keep, finding ways to do better.
Dr. Drapeau, thank you so much. You are one of our superstars this month, and we appreciate all of the work that you do.
Well, thank you very much. And I can't do it alone, so it's a team effort. And I'm just happy to be here in Manitoba and to share, what we do.